Well, good day, everyone. I hope everyone is staying safe in these crazy days. My name is Dr. Raymond Benza, and I am currently the director for the Division of Cardiovascular Medicine at The Ohio State University. I am also a PH clinician and researcher. I've been working in the field of pulmonary hypertension for over 20 years and have been involved in the majority of the main clinical trials exploring new therapeutics for the treatment of this very severe disease, and treated many patients with this disease personally. I've seen what patients have suffered through and really have come to be very close with this community. And I'm very passionate about treating this disease process. Over the last 20 years, we've seen a remarkable improvement in the way we manage patients with pulmonary arterial hypertension, so much so that we've actually tripled the life expectancy for patients with this deadly disease. Now, overall, that sounds like a good thing, but when you recognize that the majority of the patients who have this disease are young women, an extension of life from 3 years to 9 years may not be enough. So we are all dedicated to trying to find new therapies that really act at the heart of this disease in order to make a better impact on survival and to keep patients out of the hospital and make them feel better. Unfortunately, the currently available therapies do not really address the proliferative process leading to pulmonary arterial hypertension. What I mean by proliferative is that this is a disease in which the cells of the blood vessels divide in an unchecked manner. And these are the cells of the middle lining of the blood vessel called the media. And by the expansion of this media, by these proliferating cells, the vessels become smaller and smaller, such that blood cannot traverse the lung to get oxygen into them. And this causes a series of problems, ultimately leading to heart failure and to patient demise or death. So our patients need better options. They need therapies that directly attack this proliferative process in order to reverse the course of the disease, improve their survival, and their quality of life. And this is going to be one of the medications that we will be talking about today, called GP002. Now, I am a member of the steering committee and helped design the phase 2 trial for this particular therapeutic in pulmonary arterial hypertension. And I'm very familiar with the therapeutic and very excited about this. And the main difference between available therapies for pulmonary hypertension and GP002 and what makes GP002 such an exciting clinical drug candidate is that this is a new chemical identity that is developed specifically for the treatment of pulmonary arterial hypertension that targets that underlying proliferative mechanism that we just spoke about that really leads to the development of PAH and its ultimate progression. Remember, the three pillars that drive pulmonary arterial hypertension are inflammation, fibrosis or scarring, and proliferation. And this is all occurring in the blood vessels or pulmonary arteries in the lungs. GP002 has demonstrated effects on several of these underlying mechanisms and pathways, suggesting that GP002 really has the potential to be disease modifying. Again, a drug that is doing much more than just dilating the blood vessels, but actually working on the mechanisms and the cells that cause these blood vessels to close down. Interestingly, in a healthy volunteer study, GP002 was shown to be very well tolerated with no significant adverse events that were observed. And it is also being evaluated in patients with PAH in a phase 1b trial. Now, this, I believe, will be completed by the end of December of this year. So we might have some really more exciting information to talk about, perhaps in a later podcast. The other unique thing about GP002 is that it is delivered by a dry powder inhalation twice daily and can be self-administered by the patient. And this delivery system we'll talk about a little bit later because it's pretty cool. And I think most people will really like the way it works. So where is GP002 now? Let's talk a little bit about the phase 2 trial that I mentioned a little bit earlier. Again, I am part of the steering committee and helped design this phase 2 study using GP002. This particular study, phase 2, is also referred to as the TORREY study. And it's a randomized, double-blind, placebo-controlled, multi-center clinical trial to evaluate the efficacy and safety of oral inhalation of GP002 for the treatment of WHO Group 1 pulmonary arterial hypertension. Now remember, Group 1 pulmonary hypertension is the type of pulmonary hypertension where the disease is intrinsic to the arteries of the lungs. Some other secondary problem like heart failure or chronic lung diseases or blood clots in the blood vessels. It's actually an intrinsic problem of the blood vessels itself. And this study will be enrolling around 80 patients with confirmed diagnosis of idiopathic pulmonary arterial hypertension, heritable pulmonary arterial hypertension, or pulmonary arterial hypertension related to connective tissue diseases. Now, the patients who are enrolled in this study are functionally impaired. They know something is going on, but their symptoms can be minimal and really affects them only when they're really exerting themselves, or it can actually be affecting them so much that they have symptoms at rest, particularly breathlessness. Now, study sites are going to be located all over the United States, as well as in Canada and across the European Union. Now, the good thing about this trial is that unless a patient is on an inhaled prostacyclin like Tyvaso or iloprost, the patients do not have to come off their currently approved pH therapies in order to participate. That's really great. Now, the study duration will be 24 weeks in duration, and here are some of the study requirements and visits for the patients. We're trying to keep it simple. In-clinic visit spaces will be about 12 weeks apart. We wanted to make sure that we kept this simple because of the ongoing issues with the pandemic. There will be opportunity for a home health nurse for certain visits too, again, to simplify things. There are really only 2 mandatory clinic visits at week 12 and 24. And again, this is an attempt for us to be COVID conscious in these days. Now, let's talk a little bit about the administration, because as I mentioned earlier, this is really cool. The drug is going to be administered 2 times daily using a dry powder inhalation. Now, this dry powder inhalation is delivered by a very novel inhaler. I think the actual inhaler is what the cool thing. It's very discreet. It can fit in the palm of your hand. They could fit in your pocket or in your purse. And the size of the inhaler is similar to the bottle of hand sanitizer, which I hope you have all in your pockets right now, and smaller than the size of a computer mouse. If you just pick one of those up, you'll see what the inhaler size is like. So again, it's compact, easy to use, and has a well-established track record already, and the FDA has approved this for other inhalational therapies. Now, the study objective, the primary one, is to determine the effect of GB002 on improving pulmonary hemodynamics. That means the pressure in the lung or how well the heart circulates blood in subjects with WHO Group 1 pulmonary arterial hypertension, which you explained earlier what that classification is, who are functional class 2 or 3. Again, we explained the level of intensity of the disease a little bit earlier. Now, the secondary objective is to determine the effect of GB002 on improving exercise capacity in this population. And lastly, obviously, and very importantly, we want to evaluate the safety of GB002 in this population. Now, again, the specific pulmonary hemodynamic that we're interested in is the change in pulmonary vascular resistance using right heart catheterization, which many of you are familiar and probably have had in the past, from baseline to week 24. So 2 different heart catheterizations. And I remember the resistance is the actual hemodynamic that reflects the degree of arterial remodeling in these blood vessels in the lungs that we talked about earlier. And our secondary endpoints, which again is a measure of your exercise capacity, is how far you can walk in a 6-minute walk test between baseline and week 24. And again, everyone is very familiar and has probably done these 6-minute walk tests in clinic, and we know how easy they are to do. Following the participation in the study, there will be an open label extension of the study that is also planned so people can continue on this drug, which is very important, particularly if you have a really good benefit from the medication and we want to keep it going. So to conclude, those interested in participating or potentially participating or learning more about the GB002 Phase 2 study, I encourage them to talk to their physicians, and you can find out more details by using the following link, clinicaltrials.gov, and search for the TORREY study or the GB002 study. We will also have this cited at the end of this podcast today. And remember, GB002 targets a new pathway. It really acts on the cells that are in these blood vessels that's causing the disease. Given that PH currently has no cure, it's important for patients to participate in clinical trials. This is how we push the needle forward, both by allowing researchers to study new pathways like I just described, as well as helping them to discover and develop new and more effective treatments for this very deadly disease. My name is Dr. Raymond Benza, and I'm aware that I'm rare.